Hi, welcome to Contact Tracer app. This is an app where citizens can connect and engage with, and there's a CRM tool that I'll show how the medical staff can use. Here, you just logged in with his Facebook, and then he has access to the app. A simple click. You can also use your phone number. Once in the app, you can easily self-report with the red button down there, or you can see content and learn more about the virus and what to do. For self-reporting, if you don't have internet, the USSD option is available. But if you do have internet, you can self-report through the mobile app. So you can click links that are sent to you from any health institution and see more content. This is a Google News showing a map of infection. So wherever the content is from, the district authority can push it from the management tool here into the app. Users can comment on it and say how they are learning and engage, or they can click on images and like them and express how they feel about the content. For example, this image shows more things about how to get the infection. They can share the content. It's only when you're doing activities that require permissions that are granted. They can share it on WhatsApp and so on. So other content here that they see about what is the COVID-19, they can actually ask more questions, and the district authorities can actually respond to them from the tool and engage with them. So it's very educative and that drives engagement. Here, people can support the fight by donating. So it becomes a very centralized tool at the district level and the national level to receive donations from anyone who wants to support in raising funds to fight the virus. And you can use your card, and it's secure. It checks you out to a secure page. The secure page is encrypted with most current encryption methods, and this is a very high level technology that ensures safety for wherever you're making donations from. You can, by the way, also do mobile money if you want to. Um, whilst all this happens, you can actually join forums. Forums are where conversations are happening. So this is a Rich Hospital forum where you can click and chat with other people. Here you're also in the reporting your location if you think you have an issue and you want to show where you are so that they can help you directly. And over here, you can click to call directly from the app, any help number if you want to talk to someone. So this is a district number. So every district will have its own number so that people can reach them at the district level. All doesn't have to come to a very centralized point and lines get jammed. So it's very exciting. You can read more about help and report and how to get other information from the app. So in summary, is the information section, the donation section, and the menu. Here's a profile, and this part is his own profile. He's giving his own picture and he's giving his own details. Users can put that if they freely want to, so it's not insistent. The next is the iOS app. Similar functionalities. You have to allow just the permission you want, not as in by force to have everything activated. You just determine what you want to use. So you log in here with Facebook as you freely want. It loads, checks you into the app. Your profile is registered. You can see once again content from Rich Hospital as a sample. This is a person's profile picture that he's put there. The experience just his picture, his name, and stuff. And you can verify your email so that we are sure we can engage you. Once again, you can click on links and receive content from anywhere that the health authority finds reliable, and it gives them that full control. Then you can always come back into the app. It loads within the app. Users can comment, like, content, express how they feel, and have a conversation about things that are posted so that it becomes very interactive and social, and you can educate the masses. This becomes a trusted channel of communication. So once again, images that are shared can be viewed, they can be shared, people can have conversations about them, and it's simply amazing. So it's a very solid tool that allows people to engage, wherever they are. For example, this about what's the novel covered, they can like it and express their interest. Now to the donation point, it's also similar to the Android app I just spoke about. They can give you the mobile money, indicate the amount they want to give, and then they can also decide to give anonymously if they want to. All the networks are there, and anonymously means you don't know who's giving. You just want to give, but you don't want to be known, and you have that flexibility to hide your privacy. So once payments are done, you have a checkout, you get a prompt, and then you put in your PIN. And once you put in your PIN, transactions, boom, is done. So you can see a history of all your donations. So other things you can see messages sent directly to you from the hospital or sent generally to you. The hospital can engage with you as an individual, and there you have it, the forums, the messages, and it's quite amazing that you can have such a personalized engagement. You can call them at the district level if you have to, and it relieves the pressure on the central number. So you can also report your location if you need direct help. So self-reporting allows them to know exactly where you are, and they come in there to help you if you need, for example, contact tracing, or you need testing and stuff like that. And you also have access to the Ghana Health Service website, which is a de facto point of reference, so you can easily go there anytime from that app. The key thing is that the app allows you to be social and engage with people wherever you are, donate, and it has this communal and free feel. You're not being forced to give out information you don't want to. You just feel free to connect with people, connect with the health authorities. The next is a tool that the health authorities here is navigating to Greater Accra. In Greater Accra is navigating to Kaneshie, and in Kaneshie is navigating to a particular health authority called the Kaneshie Health Polytechnic. So at a very high level, districts can drill down to specific health institutions that need information. Other features include where they can see the directory of all the people, the contact tracing, and connections that exist within them. They can filter based on gender types, based on the location, like a dental senior hospital, for example. They can even search for based on different parameters. Here you can see one person who's already used the app or the USSD, and they can see contact trace information he's provided. He made contacts with a couple of people. You can indicate the location that he was and where he wants to be noted, and notes that are made concerning him. And then here is also things about communication. Here the health authorities can push content to the mobile app, to SMS, to WhatsApp, and to other social media channels. They can record their voice in their local dialect, and with the push of the button, the people in that district can hear the message and the occasional message in the local dialect. And that's a very powerful tool because education is one of the most important things now, and they can specify exactly where they want it to go to. So if it's in Tree, and maybe in Kumasi, or if it's in English in somewhere, or if it's in Ghana, in Kaneshie, they can just send specific voice messages, and a call will be triggered on the numbers of everyone. They will get this number calling them. They can listen to it and simply understand what is being indicated. Then you also have the portion about the donations. At the district level, as showed in the app, as people give freely, all that record is very transparently recorded here, because there's money that is needed to fight this, and the hospitals need money, and you want to see clearly, transparently what's happening. Here are auto triggers. You can trigger educational messages so that once somebody installs the app or dial the USSD code or goes on WhatsApp, he gets a very reassuring message. For example, educating them, not to be worried or afraid. Here you can get reports and analytics about contacts, for the past week, for the past month, how many people have engaged the past year, and with a click of a button, the system will quickly pull, all the data for you. And it can happen at a district level, it can happen at a national level, and because everything is connected, you have a system that easily engages with everybody. So you can monitor by groups, types, status of the disease and all that, and it will just simply pull the data for you, and draw graphs. You don't need any kind of training. It's a very simple solution that is designed to allow every district and the national authorities to engage with all the health departments, health in the districts, and the people at the district level. Citizens can use the app or USSD.